Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra and you're watching Med Talks Vitamin D talk show with Dr. Sanjay Kalra. Let's have the headlines for today. Now, with rising temperatures, doctors are observing a surge in individuals with sun allergy. This makes sense, but they are also observing a surge in individuals with vitamin D deficiency. This doesn't make sense. एक तरफ धूप और दूसरी तरफ vitamin D की कमी. Let's find out why this paradox occurs. A new study recommends that at least 2,000 units per day of vitamin D are required in order to prevent and treat vitamin D deficiency in the general adult population. And some people, like obese people, those with malabsorption, may need even higher doses. Adequate levels of vitamin D support the immune system and they potentially reduce the risk of developing respiratory diseases, also the severity of respiratory disease, including COVID 19. In fact, one study shows that vitamin D supplementation may reduce the risk of dementia in the future. तो ये brain health के लिए भी बहुत फायदेमंद है. And yet another study done in Japanese school children has shown that low-dose short-term vitamin D, in addition to standard care, improves levels of asthma control in them. So asthma, dementia or brain health, respiratory disease, general health, lots and lots of benefits that we see with vitamin D. So then let's go to our topic for today. Let's see what the topic is. It's vitamin D, the immunity vitamin, the happy vitamin in children. Now, many times we've spoken about vitamin D in adults. हमने बड़ों में और बुजुर्गों में कई बार vitamin D की बात की है, पर आज हम बच्चों के बारे में बात करेंगे. And for this we have our guest Dr. Neelam Mohan. Madam will be joining us shortly. In the meanwhile, we welcome everyone who has joined us. Bimla Kapoor Madam hai, Namaskar Madam. Dr. Siddharth Dhanger from Mathura. Altaf Cheema Dak Sahab, salam to Lahore. And also Dr. Aditya from Chennai. And Dr. Meshpal Singh Pawar, our expert pediatrician from Western UP. Good evening to Divakar Tiwari ji as well. And Rekha Bhattara Madam. And Divakar Tiwari ji पूछते हैं, can I give vitamin D supplements to my 21-month-old toddler? The answer is yes, certainly देने चाहिए. And when Dr. Neelam comes, we'll ask her the right dose as well. Daily Fitness World को भी welcome करते हैं. And Dr. Aditya speaks about pre-diabetes. So we'll talk about everything under the sun actually, because vitamin D is known as the sunshine vitamin. So we'll talk about everything under the sun related to vitamin D or elsewise. Otherwise, when Dr. Neelam comes, our focus will be on children, on pediatric use. But we all know what vitamin D is. Some people call it a vitamin, but actually it's a hormone. अब विटामिन ऐसी चीज है जो खाई जाती है, जो खानी जरूरी है. Vitamin is a micronutrient, so it is a part of nutrition. Some vitamins can be fat soluble, others can be water soluble, and we have to take them in the required quantity. Why they are called micronutrients is because they are needed in micro doses. बहुत कम डोज में जरूरत है, but जरूरत है. They are essential for life. Now, on the other hand, a hormone is something that is produced inside the body. ये शरीर में बनती है, and that is also produced in micro quantities. But when you get that hormone, it doesn't work just upon the place where it is produced. Like for example, a hormone may be produced in the liver, मगर वो पूरे शरीर पे असर करता है. It works throughout the body. Now, the beauty of vitamin D is that it is both a vitamin and a hormone. So actually, this native vitamin D is produced in the skin by stimulation with ultraviolet light. And then when it goes into the circulation, it gets upgraded or it gets activated through chemical reactions in the liver and in the kidney. और जब liver और kidney में ये reactions होती हैं, फिर उसका active form बनता है. Hello to Priya Patel ji as well. So, see, it's a hormone because it's produced in the skin, मतलब body में बनता है. The stimulus can be anything, it's sunlight here. And then it gets activated in the liver and the kidney. On the other hand, it is a vitamin as well because it can be ingested. Vitamin D is available in diet as well. So you can get vitamin D through dietary sources, mostly non-vegetarian. And we welcome Dr. Kunal Kaushal from Ludhiana. It's nice to see you as well. My MBBS is from Ludhiana, and my Nanka Pind is Ludhiana as well. So now, what does Nanka Pind mean in English? It means my maternal grandparents. So good to see you, Kunal, and happy to have you on the show. Dr. Aditya spoke about pre-diabetes. So let's look at the role of vitamin D and let's try to classify it. Classically, conventionally, vitamin D has been known for musculoskeletal health, both muscle and bone, somewhat for joints and nerves. So, when you have adequate vitamin D, you will have adequate muscle strength. There will be no sarcopenia. You will have adequate bone health. There will be no osteomalacia in adults, no rickets in children. And you will have good joint as well as nerve health. So, these musculoskeletal effects of vitamin D and the musculoskeletal manifestations of vitamin D deficiency have been known for about 100 years or so. The first reports came from Old Delhi more than 100 years ago, before independence. And they realized that when you supplement vitamin D or when you give exposure to sunlight, you are able to improve musculoskeletal health. However, uh, the first aspect of vitamin D deficiency, which got a Nobel Prize, it was not musculoskeletal health, it was immunity. And this is, I think, 1906 when when Nobel Prize was received for a Danish researcher got it for treating cutaneous tuberculosis. And what he showed was that if you keep people in a sanatorium, you expose them to sunlight, good air, then you are able to treat cutaneous TB. At that time, vitamin D had not been discovered, but and they couldn't make the connection also because nobody knew that vitamins existed in the world. But they were able to make out that sunlight and cutaneous TB had an interaction. So it was the immune effects of vitamin D which won it a Nobel Prize. Now, in recent years, in the past 2.5 decades or so, emphasis has shifted to the non-musculoskeletal effects of vitamin D function. Now, see, that Nobel Prize came 120 years ago. That was for cutaneous TB. But now, especially because of COVID, people realize that vitamin D deficiency is a very important risk factor for developing COVID, for developing severe COVID, and also for prognosis. So, the impact of vitamin D on COVID outcomes is well known. Similarly, on, on asthma, on psoriasis, on diseases like this, the impact of vitamin D is well known. So, this is something recent, immunity. Another factor that people have worked on is metabolic health, and this is what Dr. Aditya asks about. Metabolic health would mean cardiovascular disease, diabetes, hypertension. And it is quite clear now that vitamin D deficiency is associated with vascular disease, it is associated with dysglycemia. There are studies which show that vitamin D has a preventive effect. You can give vitamin D doses and you can prevent the onset of diabetes. You can get the HbA1c down by around 0.3%, which is quite significant. So these are recent factors. And because all these things happen hand in hand, routine vitamin D supplementation is recommended for most people across the country. So that is the current status of affairs. We also uh, have begun working more on special situations in the past 2 to 3 decades. Special situations would include, for example, antenatal women, women in pregnancy, children, the elderly. So, this is what the status of affairs is right now. We have known the impact on musculoskeletal health, we continue to use it, but now we use vitamin D more and more for its immunogenic, immune protective, and also metabolic protective effects. Priya Patel ji asked about doses for children, and we can take this, but we'll allow Dr. Neelam to join us. In general, the doses of children are relatively higher than those for adults. So, above the age of 3 years, vitamin D should be taken in an adult dose, 60,000 units once a week. This is for children above 3. 60,000 units once a week for 5 to 6 weeks. And then you can give it monthly. So let's repeat again. Above the age of 3, uh, children should get the adult dose, 60,000 units once a week. This is recommended by all the various professional bodies. Priya Patelji asks about magnesium. Yes, if there is magnesium deficiency, then certainly it has to be taken. Usually, magnesium deficiency is thought of when somebody comes in with cramps, with paresthesia, and when the calcium is normal, or there is tetany, which is not responding to calcium supplementation. Then you think of magnesium deficiency. Dr. Aditya points out that okay, vitamin D given in very high doses can cause cardiovascular disease by increasing FGF 23 levels, mainly in renal failure. So, in chronic kidney disease, we need two types of vitamin D. Earlier, it was thought that only 125 dihydroxy vitamin D is needed. And the main reason for using vitamin D in chronic kidney disease is to prevent renal osteodystrophy. So actually, the marker that we will see for renal osteodystrophy is not FGF 23; it is serum PTH, parathormone, that we will check. Then it was realized that activated vitamin D has its own effects, and native vitamin D, that is cholecalciferol, has its own. So sometimes you will see the nephrologist prescribing both 125 as well as cholecalciferol. In general, it is cholecalciferol which is prescribed routinely. However, if a patient has got severe renal osteodystrophy, PTH levels are very high, then 125 dihydroxy vitamin D is necessary. That's from the renal point of view. From the cardiovascular point of view, there is a lot of concern about calcium because you have calcified plaques in atherosclerosis, in ASCVD. Some people say that high levels of calcium lead to that. There are studies on that, but these studies comes from the West. In India, our average vitamin D and calcium is very low. Same is true for Pakistan, Sri Lanka, Bangladesh. So our average vitamin D and calcium levels are low. Our average milk intake is very low. The average milk intake per day varies from something like 50 ml per day, just 50 ml in Meghalaya, to something like 600 ml per day in Haryana, which is the highest. So usually it's not a major issue here. In fact, there are studies which show that vitamin D sufficiency is associated with less CV events and also with less progression of dysglycemia. So overall, it's a safe drug to use. If we worry about toxicity with vitamin D, the upper limit, the safe upper limit per day is 10,000 units as given by the Endocrine Society. So that is a quite high dose. That is the safe upper limit. Do note that the recommended daily allowance for the healthy adult is different from the maximally tolerated dose, and that would be different from a dose that you would give in a disease state. So the challenge that we face actually here, I think, Dr. Datte, Dr. Kunal, you will agree that when you are treating somebody with osteomalacia or a child with rickets, then the doses will be higher. When you want to prevent osteomalacia or rickets, then the doses will be lower. When you want to maintain good metabolic health, then the doses will be different. So when we are treating with vitamin D, we should know why we are treating. If we are able to answer that, then things are fine. Then we won't make a mistake. Another thing I've seen is when we say the word rickets or osteomalacia, the severity of rickets, the severity of osteomalacia is different in different healthcare systems. For example, what I would think is severe rickets or severe osteomalacia in northern Haryana, or maybe Dr. Pawar in western UP would think is severe rickets. When we go to maybe Osmania Medical College, Hyderabad, we, according to them, our rickets is very mild because they are seeing a really bad kind of rickets. But since we are speaking of rickets, rickets comes in the pediatrics domain. So let's welcome our guest for today. Warm welcome, Dr. Neelam Mohan. Warm
Hi,
welcome.
thank you so much. Wonder you, am I audible?
Yes, perfect, madam.
Oh, because I can hear a little less here. Anyway, thank you so much, Sanjay, for involving me in this beautiful session of today. And whenever it's been a long time that I came to this podium, and I think it's not possible without taking KK's name. So, being a wonderful person and as a friend, I truly enjoyed his expertise and guidance.
Thank
So, I'm yours. You can shoot questions.
A warm welcome to you from people all across the country, as well as Dr. Altaf Chima from Lahore. He sends you his salam. And
Oh,
greetings from
that's lovely.
Ethiopia as well. Yeah, Dr. Ermias Gebre Michel, who is an endocrinologist in Ethiopia, he is also greeting you.
Thank you.
Allow us to introduce Dr. Neela Mohan to everyone. Madam serves as the Senior Director and Head of the Department of Pediatric Gastroenterology, Hepatology, and Liver Transplantation at Medanta in Gurgaon. She is a renowned expert in her field, specializing in pediatric liver diseases, transplantation, and she is dedicated to improving medical care for children across the country and the world. Madam, our topic for today is children and vitamin D and the immunity vitamin. So, there are so many questions pending for you. But the first question is how important is vitamin D in children? And if, Madam, you could structure your answer first,
Yeah. So for
neonates,
that, I will
infants,
say
toddlers. Yeah.
it's for vitamin D. I have domains which are on the extreme end. Number one, it's considered as a public health issue because there's a lot of people who are said to be in the insufficient or deficient rate at one end. But at the other end, you don't really see so much symptomatic patients of vitamin D. So there has been a lot of interest generated in this vitamin, I should say, in the last couple of decades, and especially so in the last decade. And I think COVID time when vitamin D became popular in every home, there would be no home where you would not be talking about immunity and and the five things that used to talk about, which used to be a good diet, a good sleep, and an exercise, and a mental state, and of course the vitamin D and other vitamin C, etc., multivitamins that we were talking about. So during that time, so when I talk about vitamin D as an immune thing, first I would want to say is that there's a lot of papers which have come, and if I quote one of the last meta-analysis, which was in 2023, where they were trying to look at all these effects. Uh, More importance and more papers have been in the field of infection, which was related to incidents of respiratory tract infection, pneumonias, etc. So I can go on with the studies. There have been studies in Crohn's disease, which says that you can have effect. There have been studies in urticaria, in rash, psoriasis, and tuberculosis, etc. But mota, the work has been done more on infections, especially respiratory tract infections and pneumonias, and in immunity, how it can boost probably your immunity. But to understand that, you need to understand that vitamin D, first, we all know, is number one. When you think of vitamin D, you think about bone health. That's the number one thing. So it works along with your calcium, your magnesium, parathyroid hormone, all this working together in your bone mineralization. Therefore, you might have magnesium deficiency giving rise to effects because you get sort of a resistant type of vitamin D effect. So these you need to understand. So the guidelines now have been suggesting the levels which we'll talk about later. But in this, I would say that yes, studies have shown that it's more useful in prevention. For example, if I gave a regular dose of vitamin D to patients who were either asthmatic or those who had infections, flu season, in that, in those group, it has been shown that the incidence of patients acquiring a infection or a recurrent infection or the severity of infection were less. However, if you say that some patient has a pneumonia and you want to give 5 days of vitamin D, that's not really going to work. It's
Hmm.
more of a prevention. कहते हैं ना, कि फल खाने के लिए पहले आपको नींद पे ध्यान देना होगा. You'll have to work on sowing the seeds and getting its effect. So something like that with vitamin D. It's been considered as a wonder drug when it comes to immunity and autoimmunity and infections, etc. But is it a hope or a hype? Both we need to understand. There has been a little hype about it. So we've had actually in COVID time people coming with toxic doses. Toxic is more than 250 nanogram, per liter. So that also you should not do. Understand from your expert what is the right dose, which me and Sanjay will go through. But the message is yes, vitamin D has been shown to have effects on your immunity, and yes, it reduces the risk of infection, more useful in prevention. It has been shown that those children whose levels were low were statistically higher chances of infection, higher chances of recurrent respiratory tract infection, and some benefit in asthma and similarly in other infections.
Thank you, madam. So, Dr. Anup Sharma asks, so, madam, would it be correct to say that vitamin D sufficiency, ensuring that vitamin D levels are normal, would be a primordial and a primary prevention for all respiratory
Well,
illnesses and
if you
illnesses?
see, which is very right, I think guidelines are something where experts sit in and guide you. So, what basically there is no unifocal consensus universally globally about how you should do. But what the consensus has been that especially infants, we don't want to monitor whether preterm, newborns, infants first year, give them 400 international unit a day. So that's what both a lot of international guidelines and IAP, Indian Academy of Pediatrics, say. But when it comes to children and adolescents, it is said that the dose that is required for them daily, say 600 IU, we are expecting that to be in your sun exposure or in your diet. So that is why to recommend a blanket a supplementation for all children or adolescents is less than likely. Having said that, whenever there is a high risk group, any patient who's got any, like palsy, neurological, autism, spectrum, ASD, ADHD, come to my liver diseases, nephrotics, renal diseases, malabsorption, and so renal diseases. So anything which is a chronic condition, in those conditions, definitely these are called as those who are on steroids, where the immunity is less, or such things. Then in that case, you should give them supplementation for them. And the remaining group, we say that we expect if you should suggest that exposure to sun or a diet should be done. Now, what is the exposure to sun? The guidelines say 15 to 30 minutes in an infant, which is, or 30 to 45 minutes in a child, and that too around the noonish, between 11 to 2 something that time, provided your body is like 15 to 40% exposed. So that comes the problem in India. The pollution that I'm talking out, I'm sitting in the city of Delhi. So there's so much of pollution. Am I going to get, or my kid or my children are going to expose to that much of rays that I'm expecting them to get through the sunlight? That becomes $1 million question. So therefore, though globally we are saying that it should be okay, and you give it in infancy and in high risk groups, or in patients who are asthmatic and getting this infection during flu season. So therefore a lot of studies have been done. And ultimately another thing with Indians is that we are predominantly vegetarians. So if you see vitamin D, either it is more in non-veg products like egg, yolk, or liver, etc., or the fish, the tuna fish, etc. So it's predominantly non-veg, or in mushrooms, or more in fortified yogurt, cheese, milk, etc. There is amount in milk, no doubt, but it is the amount in milk is quite less otherwise. So therefore, you suggest it should be fortified, and the government is looked into it in most of the countries where there is this issue about pollution. So that is why we need to understand the sufficient, which we call sufficient is the cutoff that you're taking, say more than 30 this thing per deciliter, or 75 nanomoles per liter. So in that which you call sufficient, then uh, those risks you might like to say. So there have been some experts like me who did some studies in children where we tried to look at randomly children coming to the OPD and looking at the vitamin D level, school going children. And uh, quite a lot of them also, they were in the insufficient category, maybe because I was doing it, as I said, in Delhi NCR, which is a lot of pollution. So all needs to be looked into, into it when you're talking. But yes, when there is a suspicion, symptomatic vitamin D deficiency may not be there. But when there are issues with children with respiratory, or there has been an history with pneumonia, then studies have said that if you supplement them with 600 to 1000 international unit a day, then the chances of them improving the immunity and recurrent is less. I think I made the subject clear.
But then another point that we realize, madam, is that it also depends upon the psychosocial, the environmental factors. If a child is living in a polluted city where there is no sun, and we know that with air pollution, when our AQI goes up, the ability of the ultraviolet rays to reach the earth, to reach us, comes down. So if the child is in a polluted city, there's no outdoor games, the child is busy in school or in tuitions indoor throughout the day, then again there will be vitamin D deficiency.
So that is why, so the question what he asked is that sufficient, how do I know it is sufficient? Is it only the blood test should I do? Because the blood test is pretty expensive. So that is why, at least in us, I mean, since being I deal more with GI and liver and all these conditions, we always suggest that it is nice to supplement them a basic dose. And I tell them, as long as you live in India or Delhi NCR with all these issues and you're a vegetarian, you would need to get your supplements. And the debate whether the supplement should be a pulse bolus or regular is still, those issues have not been sorted by experts, but both have been equally effective. Some studies thought daily supplementation was probably a little better than boluses. But when you have shown for any reason a blood test which is deficient, so there are three things. One is insufficient, one is like in the lower range, which is insufficient and sufficient and deficient. So deficient is less than the 10 nanomole, which definitely you need to give, and insufficient also you need to supplement them, which is in the range, and the sufficient is the one which is, I said, more than 75 uh, moles, nanomoles per liter, or nanograms, 30 nanograms per deciliter.
Thanks. A few specific questions, madam, from the audience. Divakar Tiwari साहब पूछते हैं, can I give vitamin D supplement to my 21-month-old toddler?
Yes.
Okay, and
And
what
in
would be a
those,
safe dose?
would be around 600. So that's what we supplement, 4 to 800. You might be missing a couple of days. So that is why the drops that are available are often in children doses are 800 that you prefer. But as I said, the doses, you get some amount in the diet. And if you're using a fortified diet, then you're safer. If you're using eggs, fortified diet, cheese, milk, etc., then you're a little better. So even a 400 IU supplementation should be good enough.
And Priya Patel ji continues with the discussion. Madam, what about the dose for a 5-year-old child? Will that increase?
Well, children is the same dose. You usually say around 600, but the range 400 to 1000. You don't like to cross 1000.
So don't cross 1,000 in a
Yeah,
5-year-old child.
generally, I mean, you're giving like a preventive thing. So it's not that the person is deficient. So unless the doctor finds it in the insufficient range or deficient, then we give them a little more and then come to your maintenance of it.
And it's not that you have to continue giving the same dose. If your child is symptomatic, a very high risk child, you can always give a higher dose. And once you've achieved
Yeah.
sufficiency, then you can.
I would just like to say, please meet your expert because toxic doses are more than 250 nanograms per liter. And during COVID, we had a lot of patients coming with toxic doses because it became a breakfast dose of vitamin D. So that's also not good because that can give rise to symptoms, headache, issues, BP, and all those symptoms. So everything in life is all about balance in life. You know, everything is good and bad. So same thing, don't go on to your toxic doses. Give, like we've had patients whom you write, who is supposed to take drops which contain 800 units, but by mistake they took drops which were containing 10,000 per ml. Imagine somebody giving that for months. So, therefore, please meet your expert. Please check with the medicine that you're taking, that is, whichever the all pharma, there are differences in various pharmas and syrups and drops that are available in the market. And you also need to look at the availability, bioavailability, shelf life, what you kept, what the dose they say, is it there or not? Because there have been some studies where they used different brands and they were able to get levels with one and not with another. And I'm not going to get into that debate now. But all that I want to say is that in case there is any high risk patient, like any high risk patient with any disease, any CNS, epilepsy, drugs, palsy, autism, ADHD, chronic liver disease, renal, steroids, this, nephrotics, any chronic condition, bedridden for whatever reason, ortho, this and that, please ensure that you should give the vitamin D supplement 6 to 800 IU a day, and irrespective, and the others, the messages, if they have a good sun exposure, if they are eating a good diet, then you need to individualize and see. And if you are in a city where there is high pollution and you're concerned, then yes, like in Delhi NCR, with something.
Thank you. And Dr. Pawar, sir is an experienced pediatrician from Saharanpur. Sir says he points out that we give vitamin D drops from birth onwards.
Yes. So the Indian Academy of Pediatric Guidelines for infants, 400 international units a day. We give them for newborns to 1 year.
Dr. Dinesh Kumar ji points out that vitamin D deficiency is associated with diabetes. It will not cause, Dinesh, it's not that the vitamin D
Yeah,
deficiency will
actually, I should say to Dinesh, there was the first one of the papers was in Lancet that showed, one Lancet paper had said that the incidence of type 1 diabetes is higher if they were vitamin D deficient in less than 6 years of age. So he has a point there. I think that paper was 2001 or 11, something like that. There was a paper in Lancet.
And now they have studies which show that you can prevent the progression of pre-diabetes to diabetes by taking vitamin D.
That's what we are trying to say, that basically we are talking of prevention and not treatment. So whenever there is a deficiency, yes, so that is why it is always better to consult your expert and not overdo it yourself. We are saying, yes, there is a role in prevention of this, but that is why you need that dose. How you get that dose? whether you get it through nature, through diet, or you get a supplement. The supplement is what that you need to. So that we are very clear of that, of course, chronic this. But as I said, there has been a little hype, but yes, a lot of studies have shown that it is useful for prevention.
And Dinesh ji is doing a good practice, taking vitamin D regularly once a month, and that should keep your bones, muscles, and also metabolism healthy. Uh, the calcium
Yes, even
scoring,
I
the calcium that is, yeah, that is seen in the plaques in heart disease, that is different. So don't correlate it directly with the calcium supplements, especially in India, because in general we are a vitamin D and a calcium deficient
yeah, good
country. We
point
already
is
mentioned
saying
that.
that some people used to take extra calcium. So you need to be very vigilant. It's a good point raised that vitamin D and calcium, don't overload yourself with the calcium. Again, you need to identify the age. Women, postmenopausal definitely need supplements with the calcium. So you need to individualize it. That's why we are saying that you need to uh, connect to your expert and not just overdose with calcium, because extra hypercalcemia itself has its own issues related to renal and other issues. So there's a point.
Uh, Greetings from Ethiopia as well. And Dinesh ji says, is it necessary to give vitamin C to children?
Not really. It should be in your diet. I wouldn't want to shift everything into, what is a balanced diet? You're an Indian. If you're, remember your Indian thali. So your diet, let's come to a diet, okay. So your child should have a very good, so they should be vegetables. Vegetables are like taking care of your vitamins and minerals. They should be fruits. Fruits are going to take care of your vitamins. So that is why an ideal Nani ka nuska is I'm very fond of that. All this amla in the diet, murabba or orange, and so basically you need to take vitamin C through the diet rather than just making us get into supplements as tablets. So that's what we should be focusing on: nutrition and supplements through diet.
And vitamin C deficiency, if you see scurvy, this was found in sailors who were on the sea for so many months. They didn't have access to fresh vegetables and fruits. So if you are taking fresh vegetables, fruits, salads, vitamin C deficiency should not be an issue in South Asia. Uh, Ma'am, you spoke about
Thanks, Sanjay. Very good point. Thank you
yeah,
so much.
you spoke about autism, ADHD, these kind of neurologic and cognitive diseases in children, dysfunction in children. So Dinesh ji says, how is vitamin D neuroprotective, and is it also psychoprotective in children?
Well, I would not want to dwell into that, to be honest. Uh, as we are saying that these children get less exposure, they are found to be more in the insufficient deficient range. And some papers, there is, you will find in every field, you go and search vitiligo, you will find. You go and search immunity, rash, everything you'll find something about vitamin D. So, what we are trying to suggest, this high risk group are more in have more incidence of deficiencies and all that stuff. And since it helps to boost your immunity, through these what we are talking about, that's the whole topic is all about immunity, because in infections and autoimmune conditions, diabetes, whatever immune. And I would also think I'll go a step beyond today and say that basically it is the gut dysbiosis. So your gut dysbiosis, and the dysbiosis is higher in this autism and ADHD groups. That's what there is an entire field of gastroenterology in this, experts into this. So the incidence of food intolerance, allergy, or gut dysbiosis is higher. Whether that gives rise to a leaky gut, inflammation, and these issues, and does vitamin D have a role? This, along with the other, because you don't act individually when you do some intervention, when you're looking at this. So that's what we are saying. But we don't have a maths equation 2 plus 2 is equal to 4. But we're just basing on the evidence that we are finding that these had deficiencies, more risk of infection. So there was a trial which went on in pneumonia, if I'm not mistaken. They gave patients along with antibiotics and this. So it did not have an impact on that pneumonia, but it showed that it had an impact on further on recurrent pneumonia. So it's not that I'm telling you you have pneumonia, you take whatever D and 5 days and you'll get a magic. But having said that, there was another study where they gave it respiratory tract infection on some a little 5 days dose, and they thought that severity was less. So it's not like a randomized controlled placebo trial that I can say I can, it's like statistically significant. These are whatever evidences we are showing.
तो vitamin D will not be a replacement for standard of care. चाहे vitiligo हो, celiac disease हो, या
Exactly.
pneumonia या asthma हो, but
These
you
are
can
all the
always
cases
add to it.
malabsorption. So these is
You can use
celiac
it as well.
में ये है, vitiligo is autoimmunity, again dysregulation, again dysbiosis, again all these things come into play.
Hmm.
All that
Geeta
I can
Agarwal,
say is, as and as the science is growing up, we are going back to what people have to say, that your most diseases come through gut,
gut, through
and
your food.
which
Yes.
is because how your absorption, your exposure, your diet, your nutrition, everything is having an impact on how much you are taking. So either you don't get enough or you don't absorb enough.
गीता अग्रवाल जी, एसके गर्ग साहब एंड मीना जैन जी सब आपको गुड इवनिंग कर रहे हैं एंड एक क्वेश्चन आ रहा है मैडम फ्रॉम आरवी द मेंटोर सम चिल्ड्रन प्रेजेंट विद हेडेक or with tingling and you are not able to figure out. In adult medicine, headache is a symptom, even in children for that matter. So the quality, like let's say you're treating thyroid, the quality of your management will depend upon the quality of the TSH assay. Headache में the quality of your management depends upon the quality of your history taking. आप सवाल जवाब कैसे करते हैं मरीज के साथ, कैसे सुनते हैं? अब छोटे बच्चों में तो बड़ा मुश्किल है, they may not be able to describe, and it is so easy to say that it's a temper tantrum or a temper headache, while actually that may not be true. So the question is, ma'am, is vitamin D deficiency associated with headache in children or not?
मैं आपको ये बताना चाहूंगी, अधिकतर ये हेडेक इसलिए है कि उनका स्क्रीन टाइम ज्यादा है, और उनका स्क्रीन टाइम ज्यादा होने के कारण विटामिन डी डेफिशिएंसी हो जाएगी, नथिंग एल्स. द हेडेक इन प्रेडोमिनेंटली, वो कहते हैं ना दो खड़े हैं तो बंदा बेचारा वो हो रहा है. इट्स नॉट दैट. हेडेक इज बिकॉज ऑफ द इंक्रीज स्क्रीन टाइम इन चिल्ड्रन. एवरी डे मैं पेरेंट्स से नाराज होती हूँ और सोचती हूँ या तो मुझसे मोहब्बत करेंगे या मुझे खूब गाली देंगे, क्योंकि एवरी डे आई फाइंड इट सो मच. मतलब आई हैड टुडे a very good family and the patient was sadly like autism spectrum we had to diagnose, but from 1.5 year of age till 4 years of age, you think I'm exaggerating, he would watch 4 to 5 hours screen, and I'm not joking, educated.
Actually,
So
छोटे बच्चों
what
को
happens,
होना
ये उसके बिना ये चिल्लाता है, ये रोता है, ये टेम्पर करता है, ये वो करता है, whatever. So it's becoming, this is wrong. Your screen time can give rise to headache. That is predominant non-organic cause I'm talking about. Of course, a doctor will look into organic and inorganic. We look into the red flag signs. Red flag signs मतलब headache कहाँ होता है, कितने बजे होता है, कौन से एरिया के सर, यहाँ है, पूरा सर है, माइग्रेन है, एसोसिएटेड फैक्टर्स, फैमिली हिस्ट्री, जैसे इन्होंने बोला संजय जी ने हिस्ट्री टेकिंग, तो वो तो मैं ऑर्गेनिक रेड फ्लैग साइन में एटलीस्ट नहीं जा रही हूँ. मैं मान के चल रही हूँ कि कोई ऑर्गेनिक हिस्ट्री, ब्लड प्रेशर, ये वो दूसरी मुद्दे नहीं है, तो ऑफन आपका कारण पहले हम सबको बोलते थे कि भाई आप आई चेकअप करो, अब हम वो नहीं बोलते, हम पूछते बच्चे का स्क्रीन टाइम क्या, दैट्स आवर फर्स्ट क्वेश्चन. बट व्हेन आई वाज 20 years back, 15 years back, I wouldn't ask that question. I would say नहीं आई चेकअप करा लो.
होती नहीं थी।
Obviously चेकअप करा लो. So you change with time, and that is why the vitamin D could be a secondary thing which would be identified. Whether that is the culprit for your headache is, anything, as I said, can be.
But the primary culprit is the screen actually. So which doesn't mean that you shouldn't watch KK Med Talks. एक 20/20 रूल होता है. जब आप
Talking
KK
of
Med Talks
sugar.
दे रहे हैं, हाँ, तो हर 20 मिनट के बाद आप 20 बार बस पलक झपक लें, and that will help relax your eyes and your
Yes.
brain as well. दिनेश जी पूछते हैं, मैम, you've spoken about toddlers and about 5-year-old kids. What about adolescents? A 14-year-old child, boy or girl,
Yeah, the
in
same.
tuition
The
or
dose is
school,
the
the
same
infantile?
for children to adolescents. The recommendation is say 6 to 800 units is what we are saying when you want to give them supplements, especially give it for high risk. The same thing for, but the 600 is okay, and high risk may you can go and avoid going beyond 1,000 if there. In some age group, you in like older, you can go up to 3,000
Dr. Aditya
and
is an
4,000 a day.
Dr. Aditya is an internist from Chennai, and he says, Madam, we know that
What I'm saying, 3 to 4,000 is the upper limit. I'm saying tolerable. I'm not saying daily. Sorry, that the supplement is the same. What I said, around 600. First infant 400, thereafter 600. But max dose, the tolerance daily, if you're giving, that's what I said. Don't
right.
cross more than 1,000 in smaller babies, and more than 3,000 in children to 4,000 max in adolescents a day. But pulse is different. We're talking about.
Dr. Aditya is an internist from Chennai, and he says, Madam, we know that breast milk is very poor source of vitamin D, human breast milk. So, is there a difference in vitamin D requirement for a term baby and for a preterm baby?
Yes, there are recommendations, and Indian Academy of Pediatrics has come out beautifully on it. So you can see. But having said that, most global guidelines have come out with this. They give a little higher doses for preterm, less than 1,500 grams. But for preterm, more than 1,500 grams is the same what they would suggest for the newborns. And
Muhammad
that is
Nadeem,
why, as a blanket statement, I said that in infants, now the guidelines, most like Italian, other global guidelines, Indian, we are saying that supplementing the infancy up to 400 IU.
नदीम साहब को दिक्कत है रूमेटॉइड आर्थराइटिस की, एंड विटामिन डी इज नॉर्मल, व्हिच मींस के आप अपना बहुत अच्छा ख्याल रख रहे हैं. रेस्पिरेटरी इन्फेक्शन अगर बार बार हो रही है तो मोस्ट प्रॉब्ली कोई लंग में दिक्कत होगी, और अगर बेड रिडन रहना पड़ता है देन नदीम जी आरए का तो इलाज चल ही रहा है आपका, बट वी शुड शो अ पल्मोनोलॉजिस्ट. और कई बार आपकी दवाइयां बदल के, आपके इनहेलर्स बदल के, दे कैन एक्चुअली हेल्प यू. विटामिन डी तो ठीक है ही है हमारा, but there are other reasons also for reduced immunity.
Well, actually, it's like a Pandora. I mean, it's not all about D. You need to see most of the time. What's his age? What did he say his age is?
He's adult,
He is?
an adult.
No, adult, I mean his age, 40s, 50s, 60s.
नहीं लिखा नहीं है उन्होंने, but
Okay.
from the
So
previous
generally,
shows I
you
remember
need to
he's about
look
25.
into your
He's
other,
about
as I said, if you're an Indian or a vegetarian, you may be B12 deficient and all that. So you need to look into, consult to ensure that everything, like your essential fatty acids, your omega 3. So, what your diet you're taking, how many seeds and nuts you're taking, and almond or walnut. So, meat, even get into a basic diet, and of course, your mood. To come down from infection, please ensure that your diet is balanced. With a good diet, your activity, your sleep, your mood, your thoughts are negative or positive, your formations, all this matter in your outcome, sir.
आपने मैडम बहुत अच्छा कहा, because नदीम जी is working on his mood actually, and so
I didn't
from previous shows we know,
So I
yeah,
said,
and he's doing a
all
great
this
job actually.
matter a lot. All this
Yes.
matter, and मैं गलत नहीं बोल रही हूँ. There
तो
is evidence to say what I'm saying.
नदीम भाई दिन में 4 बार स्माइल करना है, मुस्कुराना है.
And did you know कि ब्रेन को नहीं मालूम है आप असली हंस रहे हो या नकली हंस रहे हो। तो आप नकली भी हंसे कोई कार्टून देख के, तो ब्रेन को मालूम ही नहीं कि आप उसको बेवकूफ बना रहे हो, सो यू कैन लाफ।
तो उससे हैप्पी हार्मोन्स आते हैं जो बीमारी से लड़ाई करते हैं। अब मैडम अमन सचदेवा जी आपको गुड इवनिंग कर रहे हैं, बट अगर
आपने
आपके लिए
जितना मेरा टाइम लिया था वो हो गया। आई हैव टू एंटर इनटू
we
another
will just
meeting.
ask you for one last question because you are head of gastroenterology pediatric and जुगल मुंजाल जी आपको $1 million मिलियन रुपी क्वेश्चन पूछ रहे हैं। मेरी बेटी 13 साल की
गूगल
है,
जी
वो खाना
अपना
नहीं
अकाउंट
खाती
नंबर
ठीक
भेज दो।
ये लास्ट क्वेश्चन मैडम एंड द रेस्ट आई विल टेक। माय डॉटर इज 13 years old, वो खाना नहीं खाती ठीक। ये मुंजाल जी की कंप्लेंट है।
राइट। सो मुंजाल जी, इसका आंसर एक ही है। जैसे वो बोलते ना, आप लेते क्यों नहीं, तो आप डॉक्टर नीलम से मिलते क्यों नहीं? बिकॉज इसका क्वेश्चन का आंसर इज नॉट सो सिंपल। इट्स अ मल्टी डायरेक्शनल अप्रोच दैट आई नीड टू डू। कि अगर मैं आपको पूछूं कि मुर्गी से अंडा आया या अंडे से मुर्गी आई, दोनों ही सही है और दोनों ही गलत। सिमिलरली, आप खाते क्यों नहीं is not a very simple question. It's a matter like whether you don't eat right or you don't eat. You may be eating unhealthy, like junk foods, and you don't eat healthy. So that's not khati kyun. And then, do you have issues with the gut or whatever? Everything has to be looked, and that's my USP. Trust me, I'm good.
Thank you, madam. Thank you so much for your time. We appreciate your expertise. And
And
सबकी
I would
तरफ से
like to thank you. And I would come more often on your podium because there's so much to learn. And आज मैंने नई चीज वो सीखी, विटामिन सी और वो वाली। Thank you so much कि उनको क्यों हुआ
thank you.
था।
Thank you so much. We have Shriyan with us backstage. Before you leave, Shriyan, could you please show certificate of appreciation for madam? Thank you so much, madam.
My pleasure
Thank
to
you.
always be there for KK. KK is very dear. And
Yes.
wherever you are, I miss you. We all miss you. We all love you. And thanks for setting this podium for all of us.
Thank you, madam. Thank you so much.
And to
We'll
ma'am,
continue.
doing very
Yeah.
good. She's taken up
Right.
the thing. Thank you so much, Sanjay.
Thank you. We'll continue with the show. मैडम को बहुत बहुत शुक्रिया, धन्यवाद, मेहरबानी। एंड जो अडल्ट मेडिसिन वाले क्वेश्चंस हैं वो लेता हूँ। राम जी अग्रवाल जी पूछते हैं 65 साल से ऊपर वालों को भी के बारे में भी 2-3 चीजें बता दो। तो यदि विटामिन डी 14 है तो वो कम है। At age 65, at any age 14 is less. So an average dose would be
Definitely
for
very
40.
less. It is very less. It is in the range. So please, you must take supplements.
तो दिनेश जी का भी क्वेश्चन था फॉर 40-year-old पीपल एवरेज डोज वुड बी 60,000 यूनिट्स वंस अ वीक फॉर मे बी 3 months, 2 to 3 months. उसके बाद वंस अ मंथ हमेशा लेते रहें। विनायक शर्मा जी को भी नमस्कार। कैल्शियम और विटामिन डी का फर्क बताते हैं। कैल्शियम इज अ मिनरल, ये हमारे खाने में पाया जाता है, दूध में होता है। विटामिन डी इज अ हार्मोन। विटामिन डी का क्या काम है कि जो कैल्शियम हम खा रहे हैं वो एब्जॉर्ब हो जाए, हमारे पेट से हमारी आंतड़ियों से खून तक पहुंचे, दैट इज वन। दूसरा, हमारे खून से वो जो कैल्शियम है वो हड्डी तक पहुंच के हड्डी का हिस्सा बन जाए, हड्डी को ताकत दे। ये विटामिन डी का काम है। विटामिन डी एक हार्मोन है, ये बनता है हमारी स्किन में, त्वचा में। स्किन में बन के फिर उसके बाद ये लिवर में जाता है और फिर किडनी में, और वहां जाके एक्टिव हो जाता है। तो दैट मीन्स यू नीड एन एक्टिव स्किन, you need a healthy skin, a healthy liver and a healthy kidney to have adequate vitamin D. पर अकेले स्किन से विटामिन डी नहीं बनेगी, स्किन को वो चाहिए, एक स्टिमुलस चाहिए। दैट स्टिमुलस कम्स फ्रॉम अल्ट्रावायलेट बी लाइट, वो आती है धूप से, सनलाइट से। अब 4 चीजें चाहिए विटामिन डी के लिए: सनलाइट, स्किन, लिवर एंड किडनी। जो सनलाइट है, इट इज नॉट इनफ टू से कि मैं सुबह सैर की, मैंने शाम को सैर की और मैंने कपड़े खूब पहने हुए थे। यू नीड बेयर स्किन, सो द चेस्ट शुड बी एक्सपोज्ड। और जो जो सन की जो रेज हैं उनके एंगल होते हैं अलग अलग। तो जिस एंगल पे अल्ट्रावायलेट बी रेज आती हैं, दैट इज फाउंड ओनली फ्रॉम 11 AM to 3 PM। एंड इट इज हाईली अनलाइकली, अनलेस कोई रिक्शा पुलर है, इट इज हाईली अनलाइकली कि विटामिन डी किसी का पूरा हो जाए 11 AM टू 3 PM पे। बल्कि आई एम रिमाइंडेड ऑफ दिस स्टोरी। एक राजा थे जो कभी हंसते नहीं थे, उदास थे। नदीम भाई ये स्टोरी जरूर सुनना। तो वो बड़े दुखी थे। सो उन्होंने राजवैद्य को बुलाया। ही कॉल्ड द किंग, ही कॉल्ड द डॉक्टर, द हकीम, एंड द हकीम सेड, सर यू वेयर द शर्ट ऑफ अ हैप्पी मैन एंड यू विल बिकम हैप्पी। आप खुश आदमी की कमीज पहने और आप भी खुश हो जाएंगे। So the king sent all his soldiers throughout the land and the length and breadth of the country कि चलो जी खुश आदमी की कमीज ढूंढ के लाओ मेरे लिए। तो पूरी कंट्री में वो उनके सोल्जर्स गए, दे कुडंट फाइंड अ हैप्पी मैन। फाइनली एक जगह पे एक उन्होंने देखा कि कोई विसल बजा रहा था, एंड जो आर्मी मैन थे उन्होंने सोचा ये तो सिर्फ एक हैप्पी मैन है, खुश आदमी ऐसी विसल बजा सकता है। तो जाके देखा तो उस आदमी के पास कमीज ही नहीं थी, वो अपनी भैंस चरा रहा था, एंड ही डिड नॉट हैव अ शर्ट। सो इफ यू डोंट हैव अ शर्ट, विटामिन डी विल यूजुअली बी एडिक्वेट बट नॉट अदरवाइज। Calcium is not a hormone, so calcium has to come from the diet. And one of our richest sources is milk, dairy products. Like we said, कुछ एक states हैं जहाँ पे ठीक ठाक सा विटामिन डी कैल्शियम इंटेक होता है, but ज़्यादातर states में नहीं होता. So calcium supplementation is required. For example, for a postmenopausal women, they have increased the calcium recommendation by 1.5 times in India. तो 1200 मिलीग्राम पर डे कैल्शियम चाहिए। अब इसका ये है कि व्हाई शुड आई टेक कैल्शियम विटामिन डी? कोई फर्क तो मुझे दिख नहीं रहा। पर जैसे डॉक्टर नीलम मोहन ने कहा, इट्स फॉर प्रिवेंशन, ताकि कल को आपको दिक्कत ना आए, कल को फ्रैक्चर ना हो, कल को ना गिरें, कल अस्थमा का एक्यूट अटैक ना हो या कोविड का सीवियर अटैक ना हो। सो कैल्शियम एंड विटामिन डी सप्लीमेंटेशन इज इम्पोर्टेंट फॉर प्रिवेंशन ऑफ डिजीज एंड फॉर प्रमोशन ऑफ हेल्थ। Vitamin D from dietary sources, best is fish. But all fish is also not the same, Dr. Gabriel Michel. So we have fatty fish and lean fish. Then saltwater fish or ocean fish and freshwater fish. So fatty fish that is found in the ocean, that has the maximum vitamin D. An example would be salmon. There is also a difference between farmed fish and fish that is caught in the wild. But in general, in Ethiopia, for example, or in northern India, we have access only to freshwater fish, and there the vitamin D is less. Vitamin D is minimally found in milk. So milk is good for calcium, but not for vitamin D. Also, you can get vitamin D from other non-veg sources like liver, like mutton. So that's another good source. In the vegetarian kingdom, in the plant kingdom, there is hardly any vitamin D, very little. Madam mentioned mushrooms, but that is irradiated mushrooms. The mushrooms have to be irradiated with ultraviolet B. She also mentioned fortification of milk. Now, I am not sure about the rules in Pakistan and in Ethiopia, but in India, you cannot fortify milk because that would be considered adulteration. So that is a legal bottleneck that we have, a legal obstacle. That is why we are not able to fortify our milk with vitamin D, because that would be considered adulteration then. Good evening to Anamika Anuji as well. दिनेश जी के क्वेश्चंस का तो जवाब मैडम ने दे ही दिया था, एज 14 एंड अबव। पूनम किशोर वर्मा जी को भी नमस्कार। And toxicity of vitamin D is actually highly uncommon. It will occur only in patients who are taking very high doses of injectable vitamin D. जो भी विटामिन डी टॉक्सिसिटी के केसेस हैं वो इंजेक्टेबल विटामिन डी से होते हैं, ओरल से नहीं होते। द चीफ कंप्लेंट्स विल बी हेडेक, nausea, vomiting, loss of appetite. हेडेक, nausea, vomiting, loss of appetite. एक सिंपल टेस्ट अगर आप करना चाहें, यू कैन डू यूरिन रूटीन फॉर कैल्शियम क्रिस्टल्स। तो यूरिन में अगर कैल्शियम के क्रिस्टल्स बहुत ज्यादा हों तो संभावना है कि कैल्शियम विटामिन डी बहुत ज्यादा दिया जा रहा है। And good evening to Seema ji from Kolkata as well. And like she said, yes, mushrooms when exposed to the sun, no, you have to expose to artificial ultraviolet B, right? Because otherwise the sun itself will not do too much. That way we can expose ourselves also to the sun, which is fine. But practically it will not be possible. 11 a.m. to 3 p.m. bare chested. That will be a bit difficult for most people. So mushrooms are actually grown indoor, mushroom farming. There you can use specific ultraviolet B rays, light sources to fortify the mushrooms with vitamin D. And Dr. Pawar sir says rightly so, 400 units up till 6 months of age, and then maybe 600 to 800 units after that per day. And Sumit Mahapatra ji says newborn baby duration of vitamin D, it will be continuous as long as the baby is feeding, because breast milk is a very poor source of vitamin D. So therefore we need to supplement. Okay, and Prasad ji बोलते हैं कि unfortunately Prasad Bitia has fainted twice in crowded places. That would be because of maybe a fear factor, or if the whitish color hands and feet are there, probably it would be anemia. So we need to look for anemia. And even I feel afraid in crowded places. When there are too many people around me, I just don't feel comfortable. So that would be normal. We can do what we call gradual desensitization. So don't take her directly to a very crowded place. Go to relatively less crowded places, and every week by week you increase the degree of exposure to number of people. This is called gradual or systemic desensitization. Good evening to Gaurav Sharma ji and Ajit Kumar ji as well. In a normal person, Mohini Butara ji, actually vitamin D deficient नहीं होगा. क्या symptom कोई नहीं होगा. So usually vitamin D deficiency will be asymptomatic शुरू में. जब बहुत severe deficiency होती है, then you have pain in the legs, difficulty in climbing stairs, difficulty in going to the temple और गुरुद्वारा साहिब और mosque, नमाज पढ़ने में दिक्कत आती है, घुटनों में दर्द होती है. आप अपनी किचन में अपनी बाजुओं के साथ ऊपर आप हेवी सामान नहीं रख पाएंगे, ये बाजुओं की दिक्कत है, बट दिस विल कम इन द सिवियर स्टेट. तो उसी से पहले ही वी शुड ट्राई टू करेक्ट द डेफिशिएंसी व्हेन पेशेंट डजंट हैव सिम्टम्स. सन एक्सपोजर जैसे कहा, एंड मैडम भी कह रही है, नॉट ओनली फॉर विटामिन डी बट आल्सो फॉर डिप्रेशन, एंजाइटी, क्योंकि धूप से मूड खिलता है. सो इन इंग्लिश वर्ड इज एप्रीसिटी. तो आज और कल से मेरी सिटी में एप्रीसिटी है. एप्रीसिटी मीन्स द फीलिंग ऑफ वार्मथ ऑफ द विंटर सन. So we had not had apricity, APRICITY, apricity for the last 2 months in Karnal. Now we have sunlight and we are happy. Vitamin D for tuberculosis, highly recommended. Only thing is tuberculosis and sarcoidosis patients, they actually might get hypercalcemia, because in the granulomas, in the tuberculosis granuloma, you can have extra conversion. So we can give something like 60,000 units once a week. That would be safe. And if Dr. Armias, you wish to monitor, the cheapest way would be to do a urine routine for calcium crystals. So actually in tuberculosis, vitamin D will have a immune strengthening and anabolic effect. Thank you to Dr. to SK Garg ji as well. Thank you from the bottom of our heart, sir. आप हमारे साथ हैं. Areva and Pawar sir is applying for President IAP 2024. Best wishes, sir. Best wishes to you. Cheering for you. राकेश शर्मा जी कहते हैं 7 साल की बिटिया है, फीलिंग मसल पेन. तो अब यहाँ पे हो सकता है चोट लग गई हो. इट्स पॉसिबल शी हैड एन इंजरी, बट विटामिन डी, कैल्शियम आर इम्पोर्टेंट फॉर हर, एंड सनलाइट एक्सपोजर. Dr. Aditya raises a public health challenge: vitamin D supplementation for fracture prevention in school children in vitamin D deficient area. So in school children, like in children, it's rickets. So there can be micro fractures, of course, but here the main aim is to prevent short stature, to ensure adequate growth. So vitamin D supplementation should be done. At a general public health level, you can say something like 60,000 units once a month. In adults, where we are worried about osteoporosis, especially postmenopausal women, then the main aim is fracture prevention. हाथ में खुजली प्रसाद जी ने पूछा, सो वहां निशान पड़ जाता है, so this would be an allergy and skin की problem होगी ये. So we should actually show a skin specialist without giving medicines. And this challenge that Sharma ji faces is the Mumbai air quality is bad. It's bad all across the country. Children falling sick often with cough and fever. Like Dr. Neelam said, a balanced diet, physically active lifestyle, whether you are doing physical activity indoor or outdoor, whatever is convenient, and that actually improves immunity. Also, try to reduce exposure to crowded places. If you are going to a crowded place, no harm in wearing a mask. That I think we should try to follow. And regular vitamin D supplementation, regular exercise, and a balanced diet. These are things that we would focus on. Sumit Mahapada ji, okay, speaking about newborn, yes, 1 year. Until exclusive breastfeed, we should continue. There's no need to test also. It's a young baby. Why should we prick the child? As long as the breastfeeding is continuing, vitamin D will be required. And in pregnancy, vitamin D, yes. In fact, in second and third trimester, of course, we supplement. Now there is a strong body saying that vitamin D should be given in first trimester as well. And here again, the aim is to reduce vascular diseases like preeclampsia or recurrent or pregnancy loss. So why they are using it in first trimester now? And there's a lot of discussion around this. That is to prevent PIH and to prevent pregnancy loss. And like Sumit said, yes, without test, we can safely give it to an infant who is breastfeeding. Now, why do students faint in schools during morning assembly across India? Yes, this is common. Maybe they have not had enough to eat in the morning. They woke up early morning, 4 o'clock, 5 o'clock to catch the bus, and maybe it's too hot at that time. So I think before the assembly, they should eat something. Nobody should go to school hungry. They should eat something before going. Thank you to M.A. Lambe Saab and Ajay Parihar ji. Thanks for being with us. Oh, vitamin D is a tough thing, Prasad bhai. The more you read about it, the more confused you become. And it's good to sort of speak with each other, ask questions, take comments, because we all keep on learning. See, Dr. Neelam is one of the senior most pediatricians. She's the top in her field. And for her also, talking about vitamin C was new today. Salam to Dr. Noor Aga Danish from Kabul, Afghanistan. Salam, sir, and welcome to the show. Thanks to Ajit for us. We all agree Dr. K.K. Agarwal was a legend, yes. And nasal spray vitamin D, yeah, you can use that, Mukesh. My brother uses it and he's happy. No specific side effects, but it might cause rhinitis in some people. Oral 60,000 a week should be fine. But then all these different um, preparations are available because people prefer different types of preparations. Good evening to Reshma ji and Dr. Ashok Kumar as well, and Anita Dadlani ji. It's great to have you with us. SK Garji asked about which part of the body. So we mentioned sunlight, skin, liver, and kidney in that order. And Reshma ji says vitamin D at all ages. Yes, irrespective of their blood reports, it would depend upon the child's lifestyle, not specifically age. You cannot assume that all adolescents in India or Ethiopia or Afghanistan have exposure to sunlight. The pollution levels are different in different cities, towns, and villages. So it depends upon the lifestyle. I think that should be the uh, main parameter to help us decide whether we can give vitamin D, irrespective of a blood report or not. Kamla Devan ji पूछती हैं, does excess calcium intake cause calcification of blood vessels? No, it doesn't. Uh, Whatever reports you see from the West. तो जो plaque है, वो cholesterol का बनता है heart में. The plaque is because of cholesterol. With age, it gets calcified. It will get calcified sooner or later, but it's not because of the calcium intake that we are making. And vitamin D, when eosinophils increase, so it is eosinophils means there's an allergic reaction, some kind of an allergic disease is there. Vitamin D may help prevent the reduce the severity of that disease. Yes. So with this, I hope that we've been able to take all the questions. आज डॉक्टर नीलम ने हमें एक डिफरेंट फीलिंग दी पीडियाट्रिक पॉइंट ऑफ व्यू से एंड वी आर ग्रेटफुल टू हर बट Sriyan, what did you learn today? Anything new that you learned today about vitamin D?
Yes, sir, I did learn about the importance of sunlight, like how important is it to spend some time in some sunlight, and that's all I learned, and many more things as well from ma'am and you. Thank you, sir.
Thank you. And to everybody who has logged in, thank you so much. We have people from across the country, from Pakistan, Afghanistan, and from Ethiopia as well. It's one world, one family, and we are united in our aim towards achieving good health. Sunil Bade ji ko thank you for logging in. And sabko shukriya, dhanyawad, meherbani. And like we always say in Haryanvi, thara bhala ho. Jai Hind.